Today I will be talking about the next two structures of the respiratory tract or the system. These are the pharynx and larynx. And in this video I will be discussing the developmental anatomy of these two structures as they originate from the same embryological source. But before moving on to the embryological development of pharynx and larynx, let me give you a small overview of these structures. Here in front of you is a sketch showing us the side view of a human face and neck. And we can see that these are the two tubes. One is lying posteriorly and the other one is anterior to it. These are pharynx and larynx. Pharynx is the posterior tube while larynx is the anterior tube. They are present in the midline, and we can feel the prominence of larynx or laryngeal prominence by just putting a fingertip on our center of our cervical region, which is the neck region. The pharynx, it's a longer tube and it's almost 5 inches in length. It starts or takes its origin from the base of the skull. So here in front of us is the base of the skull, if you look at it. So this is the sphenoid bone, the body or the basal occiput part of the sphenoid bone. Here the first part of the pharynx, that is the nasopharynx, gives its attachment. So the pharynx starts from the base of the skull behind the nasal and the oral cavity, and it just comes down as a muscular tube and ends at the level of 6 cervical vertebrae. Okay, so pharynx, a 5 inches long fibromuscular tube, starts from the base of the skull and terminates at the level of 6 cervical vertebrae. Okay, what is the function of pharynx? It acts like a common pathway for food and air and connects the nasal cavity to the larynx and the oral cavity to the esophagus. Now, what about the larynx? The larynx is way more smaller in length. The larynx is almost 2 inches long. It's a membrano-cartilaginous tube, and it starts from the level of 4th cervical vertebra and ends again at the 6th cervical vertebral level where the pharynx is ending. Okay, so it's almost 2 inches long, less than half the length of the pharynx. Larynx is also a hollow tube, and what's the function of larynx is it provides a constantly patent airway because of the presence of the cartilage and membranes in its structure, and also it provides a switching mechanism for the food and air to pass into their respective passages. The third and very important function of larynx is the production of voice, and that's why sometimes it's been known as the voice box. Okay, these two structures are tubular, but they are incomplete tubes. Why I'm saying that they are incomplete, you can see over here that the pharynx is posteriorly, it has a wall, but anteriorly the wall is deficient. While the larynx is the opposite. It has an anterior wall while the posterior wall is missing. So both these tubes, they complement each other. They complete each other. This is the pharynx with its posterior wall intact, made out of membrane and the muscle tissue, while not membrane, the fibrous and the muscular tissue, while the larynx, which is smaller, it is made out of membranes and cartilages. It has the anterior wall while the posterior wall is incomplete, and together they form the throat region of our neck. Okay, I will be discussing the detailed anatomy of each of these tubes in the later video, but for now we'll move on to the developmental anatomy of the pharynx and larynx. So what happens is that during the 4th week of intrauterine life, or at the end of 3rd week of intrauterine life, the embryo especially the cranial end of the embryo, is showing small bulges in the region of future neck. Okay, these are known as the pharyngeal arches. The bulges are known as pharyngeal arches. Actually, it is a full apparatus with the arches. The bulges are the arches, then these are the grooves are present in between each bulge. So these are the grooves, pharyngeal grooves. And then if you cut open the wall of the pharynx, which is the first part of the gut tube, through which these bulges are coming out on either side like these, right? So if you cut open, you will be able to see that every arch has a pouch as well. So we have, in the humans, in other vertebrates, there are 6 pairs of pharyngeal arches and pouches and the grooves. While in humans, there are just 4, because the arch number 5, it just gets resorbed. The arch 4 and arch 6, they overgrow and then they cover up the arch number 5 in the human embryo. So we just have 4 arches, 4 pouches and the grooves. The arches, pouches and grooves together is known as the pharyngeal apparatus. I will be talking about the pharyngeal apparatus in detail when I will be discussing the developmental anatomy of the head and neck region. Okay, because these arches, this apparatus plays a pivotal role in the growth of the head and neck. Okay, but at this moment we are concerned with our 2 structures, pharynx and larynx, right? So I have given a specific color to every arch, so they are color coded. Arch number 1 is red, the second is yellow, the third is purple, the blue is the 4th one, and the brown is the 6th one. Today we are concerned with the 4th and 6th. We don't call them 4 and 5 because the 5th is being sandwiched between 6 and 4. So we just skip it. We say that there is arch number 4 and then arch number 6. Our 2 structures of today are developing from these 2 arches, 4 and 6. Okay? Before moving on to the structure itself, I have to mention that each arch it's mesodermal in origin. It develops from the middle layer of the embryonic disc. We have an ectoderm which gives origin to the skin, superficial subcutaneous structures, as well as the nervous system. Then we have the mesoderm which gives rise to the musculoskeletal elements of the human body, as well as the cardiovascular system and urogenital system. So we know that the muscle tissue, the cartilage tissue, the bone tissue will be coming from the middle layer, mesoderm. Okay? Then we have an endoderm, which is nothing but it's lining all the hollow tubes of the embryonic body or the human body, and also gives rise to majority of our glandular apparatus. Okay? So the arches, they have a mesodermal component, and each arch is having its own artery, vein, like its own vessels, and its own nerve, because this is the cranial end of the embryo. So we have 12 pairs of cranial nerves, and these cranial nerves will be innervating different developing structures in the head and neck region. Alright? So the nerve of the first arch will be the mandibular division of, the trigeminal nerve. Okay, the 5th cranial nerve. The nerve of second arch would be the 7th cranial nerve, facial. The nerve of third arch would be the glossopharyngeal nerve, which is the 9th cranial nerve. While the nerve of 4th and 6th arches is the 10th cranial nerve. Just keep this point in your mind and we'll move on, because we will be revisiting this concept in a few minutes. Okay? Alright, now here is the diagram showing us a cut open model, or rather, so this is, I have made a model, and we can see that the green thing is the pharynx, or the top part of the gut tube of the embryo, okay, the first part after the oral cavity. This membrane is representing the partition between the future oral cavity or stomodium and the future pharyngeal cavity, which is present in the neck region, okay? So this is a limiting membrane. This is known as the buccopharyngeal membrane, okay, or stomodial membrane, all right? So here is the pharynx, so the posterior wall of the pharynx, and this is the anterior wall. In the embryonic terms, we can call it the dorsal wall, which is facing the ceiling, and the ventral wall, which is facing the floor, okay? Our respiratory diverticulum, or the structures of the respiratory tract, will be originating from the ventral wall of the pharynx, okay? In the 4th week of intrauterine life, what is happening is the arches are giving rise to the ventral walls of the 4th and 6th arch will be giving rise to the laryngeal structures, okay? How? Let's have a look. Now what is happening is I have opened up the pharyngeal apparatus, and you are looking at it from inside, okay? All right, so we are not concerned with these first 3 arches, but I have to give you a little bit of overview so that you will be able to know what is happening here. The first arch is going to give rise to, ultimately is going to give rise to the anterior 2/3 of the tongue, which is present in our oral cavity, okay? While the second arch, in the other drawing, you can see the purple second arch is overgrowing, and it outgrows the third arch outgrows the second arch. Like the second arch has become sandwiched between the first overly growing arch and the third overly growing arch. So it comes under, it gets undermined, the second arch, okay? Here is our original tongue, like pretty much it looks like an adult tongue with the anterior 2/3, then there is a demarcation line which is known as the sulcus terminalis, and it has the circumvallate papillae which get innervation by the cauda tympani branch of the 7th cranial nerve, which is the nerve of the second arch, if you remember. That cauda tympani branch is innervating these special gustatory taste buds, right? The circumvallate papillae, okay? And they are present at the sulcus terminalis, all right? In the center, there is a foramen cecum. This foramen cecum is indicating the origin of our gland, which is lying in front of the larynx. That is the thyroid gland, okay? It develops from the back of the tongue and it will descend down along with the other structures, all right? Here you can see that the purple or the third arch is overgrown. It has undermined the second arch. And you can see it is making the posterior 1/3 of our tongue the pharyngeal part of the tongue. Because tongue anteriorly it is free, while the posterior part of the tongue is fixed with the pharynx. So this is the pharyngeal part of the tongue that is coming from, it's originating from the 3rd pharyngeal arch. Here, if you come back to the drawing A, you can see that the 3rd pharyngeal arch is also having a prominence. It's known as the hypobranchial eminence because it is a visible spot while the embryo is developing. So they call it an eminence, okay? So the hypobranchial eminence is getting contribution from the some of the second arch, majority of the third arch, and a little bit of the fourth arch. Our concern is with this element of the fourth arch, which is contributing into the formation of the hypobranchial eminence. This will give rise to one of the cartilages of the larynx, which is elastic in nature, and it's known as epiglottis. Okay, so if we move on to, before moving on, let's see this is the blue is the fourth arch. It will give rise to most of the cartilages of larynx, including the epiglottis. Then the sixth arch is going to give rise to the musculature of larynx and also pharynx. All right. Move on to the drawing B. You can see over here. Now focus in this region, right? This is the top part of the fourth pharyngeal arch, which is also contributing in the hypobranchial eminence. This will transform into a leaf-like structure, which is the epiglottis. And these are the prominences being produced or created by the developing arytenoid cartilages. Okay, so larynx has multiple cartilages. Two of them, like the one pair, which is very important because it is holding the vocal ligaments, those are known as the arytenoid cartilages. So when they are growing, they are bulging into this space. And you can see over here, come back to the drawing A, this slit-like opening which is present here in the ventral wall of the pharynx, which is connecting the pharynx with the larynx. It must be present here, right? This is known as glottis. Okay, initially in the beginning, like during the 4th week, the glottis is like a longitudinal slit. As the development is progressing in the subsequent weeks, and the other cartilages are also developing, due to the growth of the arytenoid cartilages and also the further development of the epiglottis, this straight longitudinal slit-like glottis will transform into a T-shaped opening, which is the actual adult form appearance of the laryngeal opening, that the glottis. Okay, we call the laryngeal inlet as glottis. If you do a laryngoscopy and you try to peep into the laryngeal opening, you will find this T shape. As we have seen that the 4th arch, the mesodermal component of the 4th arch is going to give rise to the epiglottis at the top, the thyroid cartilage, the cricoid cartilage, the arytenoids, cuneiforms, and corniculate cartilages of the larynx. Some of them are unpaired and some are paired cartilages. Okay. Other than these cartilage components of the larynx, the 4th arch will also give rise to the pharyngeal constrictors, which will make the posterior wall of the pharynx, and the levator palati muscle or levator palatini muscle, which is the muscle of the soft palate, and the mucosa of the larynx above the vocal cords. Okay, so in the beginning I mentioned that each arch has its own cranial nerve. So the arch number 4 has the vagus or the 10th cranial nerve cervicate. Which branch of vagus? The superior laryngeal branch. Where should I write? If this is vagus coming down from top, it gives off 2 branches in the neck. One is the superior laryngeal, and the other one, it just goes down till the level of the cardiac plexus, just above the subclavian. It gives up the subclavian or brachiocephalic vessels. It just gives off another branch which climbs back to the neck, and that's why it is known as the recurrent laryngeal. Okay, and it is also sometimes known as the inferior laryngeal branch. So we have a superior laryngeal branch of vagus nerve, which is the nerve of the 4th arch. The arch, which is blue colored, it is giving rise to the cartilage components of the larynx and also the pharyngeal constrictor muscle. So the motor branch from this superior laryngeal nerve will supply the constrictors of pharynx and will also supply the levator palatini muscle of the soft palate, while the sensory component will go inside. It's the internal laryngeal branch which goes inside and supplies the mucosa of the larynx from inside above the level of vocal cords. I will discuss it in detail when we'll be doing the detailed anatomy of the larynx. Okay, while what happens with and there is another muscle, the cricothyroid muscle of larynx, which is an external muscle of larynx, that will also be supplied by the branch from the superior laryngeal nerve. Then the other branch of 10th cranial or vagus nerve, which is serving the 6th pharyngeal arch. It's the recurrent laryngeal, which I just have mentioned. It is going to take care of the structures which are derived from the 6th pharyngeal arch. And these structures are mostly the muscular components of the larynx, the intrinsic muscles of larynx, and some of the extrinsic muscles also. So the recurrent laryngeal nerve is going to serve the musculature of larynx in general, except for cricothyroid muscle, okay, which has been taken care by the superior laryngeal branch. Okay, so I want you to understand this map of innervation, which has a connection with the developmental history. Okay, we know that the anterior 2/3 of tongue, it gets its sensory innervation from the lingual nerve, which is a branch of the mandibular division of trigeminal or 5th cranial nerve, which is the nerve of first arch. And you know that the anterior 2/3 of tongue is developing from the first arch component. Okay, then at the junction of this anterior 2/3 with posterior 1/3, there is a V-shaped sulcus, the sulcus terminalis. In this is buried the component of the 2nd pharyngeal arch. So we know that at the sulcus terminalis we have the circumvallate papillae, which are getting their special sensory innervation from a branch of the 7th cranial nerve, which is the nerve of the 2nd arch. The name of the branch is the chorda tympani nerve. Okay, then the 3rd arch is overgrown, has undermined the 2nd arch, and it's giving rise to the posterior 1/3 of tongue. The sensory innervation of the posterior 1/3 of tongue is coming from the 9th cranial glossopharyngeal nerve. Glosso means serving the tongue. Pharyngeal, it's also serving the part of pharynx. The 9th cranial nerve is the nerve of 3rd arch, and you know that the sensory innervation of the posterior 1/3 of tongue is coming from the 9th cranial. Then also the posterior most part of the tongue, which is attached to the pharynx, it's also known as the pharyngeal part of the tongue. It's been receiving its innervation by the pharyngeal plexus, which is being formed by the branches of the glossopharyngeal, the 9th cranial and the 10th cranial. Okay, so then we know that the epiglottis, it's also covered by the mucosa from the top, as well as like the oral part of the epiglottis, right? And the the laryngeal part of the epiglottis. So the oral surface or oral part of the epiglottis is facing it's lined by the mucosa, which is similar to the mucosa of the tongue, okay, or the oral mucosa, while the lower part of the epiglottis or the laryngeal surface is covered by the typical respiratory mucosa, which is the pseudostratified ciliated columnar. So the oral mucosa is the stratified squamous type. So the top part of the epiglottis is covered by the stratified squamous type of epithelium, while the lower part or the laryngeal surface is covered by the pseudostratified ciliated columnar type of epithelium. Okay, so I think by knowing the embryological origin of these two structures, we can understand this complicated relationship between the pharynx and larynx, as well as the posterior part of the tongue. The relationship between the posterior 1/3 of the tongue or pharyngeal component of the tongue and the epiglottis, glossoepiglottic fold, right? Because all these structures are developing from one source, that is the pharyngeal arches, and they are developing in close proximity. So they are interlinked with each other in the matters of innervation and the vascular supply, and also the mucosal lining.